Did you guys see Lady Gaga's earpiece? Thank you for joining us for this special edition of KPBS News. I'm Maya Trabulsi. Much of our coverage this week is devoted to the push to vaccinate San Diegans. But sadly, this week brought the milestone of 2,000 local deaths since the pandemic began. Half of those have been lost just since November. KPBS reporter Claire Tregesser goes beyond the numbers and shows us who is bearing the brunt of the virus.
It took almost 9 months for the COVID-19 death toll to reach 1,000 in San Diego County. But since then, a period of less than 2 months, the region has surged to more than 2,000 deaths. And experts expect the number to continue rising rapidly for at least another month, if not two.
We're probably 6 to 8 weeks out.
Dr. Tom Laurie is the chief medical officer at Sharp Memorial Hospital. He says a spike in infections leads to a surge in hospitalizations 2 weeks later, which leads to another surge in deaths 2 weeks after that. So even if infections plateau in the region, which so far they have not, deaths will continue to rise rapidly for weeks to come. But he does not think the rising death numbers can be attributed in any way to a lack of medical resources in the county.
Throughout the pandemic, we've been able to shift our resources, either move resources to patients or patients to resources with great efficiency. And that's one of the things that I think has been invisible to the public is we're so good at doing these things that we've been able to absorb nearly 50 to 100% above what we normally take care of. And it hasn't looked like we've done that much to the external side of things.
But the pandemic continues to impact people disproportionately depending on their race and where they live in the county. Almost half of the people who died lived in East and South County, while just 11% lived in the North Coastal area. The county's Latino community is still being hit the hardest, accounting for 44% of deaths, even though Latinos make up 34% of county residents.
I think that the fact that things haven't changed really hasn't surprised us.
Nancy Maldonado is the CEO of the Chicano Federation of San Diego County.
If you look at where those infection rates are coming from, it's from a lot of these frontline jobs, a lot of these essential workers that are being exposed to the virus, and that hasn't changed. As the latest report shows that numbers for grocery store workers and pharmacy workers are going up. Of course they are. I mean, these are people who are at risk of exposure.
Maldonado says people in these jobs are less likely to feel confident demanding protections from their employers. And people of color are often treated differently by doctors.
How people's symptoms are being interpreted, and that oftentimes people are sent home even though their symptoms would indicate that they should not be sent home.
All of these inequities contribute to a tragedy that people are still not fully grasping.
Every single one of those numbers is an individual that was, a son or a daughter, or mother or a father. And we need to get back to understanding that these are all human beings. And unfortunately, it doesn't really hit people until it impacts them directly.
Low-income frontline workers are most at risk because of both their living and working conditions, says Rebecca Fielding Miller, an epidemiologist at UC San Diego.
Grocery store workers or your pharmacy staff or sort of your Rite Aid or CVS workers, they might have also done things like gathered themselves over the holidays, but also the people coming into these public spaces are now higher risk. And so you have this dual, like two different like waves crashing into each other.
For doctors and nurses working in hospitals, the daily death toll of the virus is inescapable, says Lori with Sharp Memorial Hospital.
I worked Saturday and Sunday, and every time I go into the ICU or into the COVID units, I'm always impressed at how calm, cool, and collected they are, and how confident they feel that they're providing the care that's needed to their patients. That being said, for the first time in the last 3 to 4 weeks, they still have the same level of confidence. They still have the same calm approach to taking care of their patients, but their morale is wearing thin. That's the biggest thing, is they just are subjected to this continual onslaught of patient care that we haven't had to do ever in our careers.
While most doctors and nurses are now vaccinated, and there is hope that numbers will begin to slowly go down, Lori says there is still a long race that needs to be run. Claire Tregesser, KPBS News.
That's just one of the stories you'll find on the Tracking COVID-19 page at kpbs.org. We also have our live blog with the latest updates throughout the day and the latest case numbers broken down by zip code. It's part of our robust online coverage right now at kpbs.org. One of the trusted faces of the past year is Dr. Anthony Fauci, now working with the Biden administration on COVID-19 response. He has this to say about former President Trump's approach and how misinformation may have cost lives.
You know, it very likely did. You know, I don't want that, John, to be a soundbite, but I think if you just look at that, you could see that when you're starting to go down paths that are not based on any science at all, and we've been there before, I don't want to rehash it, that is not helpful at all, and particularly when you're in the situation of almost being in a crisis with the number of cases and hospitalizations and deaths that we have. When you start talking about things that make no sense medically and no sense scientifically, that clearly is not helpful.
Dr. Fauci is now President Joe Biden's chief medical advisor on the pandemic. In an appearance in the White House briefing room on Thursday, he said he feels liberated to speak freely and stick to the science when it comes to public decision making. And another familiar face will no longer be part of the government's response. Dr. Deborah Birx, a member of former President Trump's COVID-19 task force, is retiring. Her role officially ended with the inauguration of President Biden. We're now well over a month into the vaccination process, and here in San Diego and across the country, health workers are struggling to get shots into arms because they simply don't have enough doses. Nick Watt shows us how cities are trying to meet the challenge.
In California, it could take about 5 more months to vaccinate 75% of the over 65s if the current sluggish rate continues.
Get on the ball, guys. We're out here.
New York State has just 2 or 3 days worth of doses on hand.
You will see a constant pattern of basically running out, waiting for the next week's allocation, and then starting up again.
If the nation continues at this sluggish rate, it'll be more than a year before 75% of American adults are fully vaccinated.
This needs to be all hands on deck, really a wartime effort.
The compounding crisis of COVID.
You just heard the new president actually has a detailed plan, and more vaccines are coming, likely among them a single-dose option from Johnson & Johnson.
They are literally within a week or two of getting their data analyzed so that we can make a decision.
Nationally, average new case counts are falling for now, rising in just one state, Virginia. But COVID fatigue and more contagious variants could change that.
I worry desperately in the next 6 to 12 weeks we're going to see a situation with this pandemic unlike anything we've seen yet to date. And that is really a challenge that I don't think most people realize yet.
Inauguration Day, a near record COVID death toll reported. 4,375 dead. Now, among the dead, the sign language interpreter at COVID briefings in Hawaii. Patty Sokol was also a mother and a grandmother.
And the virus just took hold in her body and ravaged it.
The CDC now projects this nation could reach over 500,000 COVID dead, maybe 100,000 more lives lost before Valentine's Day.
That was Nick Watt reporting. Now, if you want to know just how much progress we're making on vaccinations, you can do so on the newly launched Vaccination Dashboard at kpbs.org. It shows the number of local vaccinations compared to the total population. You can also find a list of vaccination centers. To see the tracker, go to the Tracking COVID-19 section at kpbs.org and click on Vaccines. San Diego County has its second vaccination super site up and running, and this one is located in a community among the hardest hit by the pandemic. Jacob Ayer shows us how those at risk in the South Bay are rolling up their sleeves.
The Chula Vista site builds off of the county's first vaccination superstation outside of Petco Park. Both locations are administering vaccines 7 days a week to people eligible under Phase 1A. That includes healthcare workers, those in long-term care facilities, and individuals 75 and older. Firefighter paramedics and nursing students will help administer vaccines to eligible residents at the Chula Vista site.
Right now we are scaling it to be able to deliver 5,000 vaccines on any given day. And we do believe we can even scale up higher than that. And so this is really built out for even a higher capacity. We will start today with 1,800 vaccines being given.
While the Petco Park location is a partnership with UC San Diego Health, the Chula Vista site has the county, City of Chula Vista, and Sharp Healthcare working together. The new site was selected to provide an equitable distribution of vaccines, especially to hard-hit communities like those in the South Bay.
Any of the future investments, including vaccine distribution, is going to be made in communities that where the highest need is in the region. And we're going to do this based on science and data.
Across Southern California, COVID-19 super vaccination sites continue to grow, with 2 locations up and running in Orange County and 6 now operating across Los Angeles County.
While the rollout of the vaccine has seemed slow, it's collaborations like this one that we are announcing today that improves access to a life-saving vaccine that will allow us to return our kids to school, reopen our businesses, and rebuild our economy.
Sharp Healthcare will start vaccinating some of their own patients 75 and older starting tomorrow at select locations. Those eligible will be directly contacted by their provider. If you or your loved ones qualify to receive a vaccine, regularly check the county's website, vaccinationssuperstationsd.com, to book any available appointments. Jacob Ayer, KPBS News.
We need to scale up in a hurry, and a big part of that is finding qualified staff who can safely deliver the vaccine. There's only so many doctors and nurses to go around. Coming up a bit later, we'll show you how healthcare workers are being trained to take part in this critical mission to get the virus under control. President Joe Biden has already issued a series of executive orders relating to the pandemic, but much of the heavy lifting will require Congress. Karen Caifa has more on America's new approach by a new president.
To a nation waiting for action, let me be the clearest on this point. Help is on the way.
1 year and more than 400,000 American deaths later, President Joe Biden has inherited a crisis like no other. And on his first full day in office, his team is wasting no time.
This crisis is dire and it requires immediate action, and we hope and expect members of both parties to work together to do that.
The Biden administration has a national strategy for getting the pandemic under control, and the president signed at least 10 executive actions focused on COVID-19.
Our national plan launches a full-scale wartime effort to address the supply shortages by ramping up production and protective equipment, syringes, needles, you name it.
Dr. Anthony Fauci, now Biden's chief medical advisor, believes the United States can reach the president's goal of 100 million COVID-19 vaccines administered in 100 days and may be able to surpass it.
The concern I have, and something we're working on, is getting people who have vaccine hesitancy, who don't want to get vaccinated, because many people are skeptical about that. So we really need to do a lot of good outreach for that.
And House Speaker Nancy Pelosi says she's eager to get Biden's COVID relief bill passed.
What the country needs to crush the virus, put money in the pockets of the American people.
In Washington, I'm Karen Caifa.
The leader of the state's second largest school district is being called to Washington by President Joe Biden. KPBS reporter Matt Hoffman has more on San Diego Unified Superintendent Cindy Martin's nomination for Deputy Secretary of Education.
Martin is being tapped to be the second in charge of the U.S. Department of Education. She's been an educator for 3 decades, spending part of her time at Central Elementary in City Heights, later becoming principal there, before being chosen to head one of the country's largest school districts in 2013.
Children who come from struggle, whatever that struggle may be, can achieve and achieve at high levels.
In a letter to parents of the 100,000 plus San Diego Unified students, Martin said she has never been more optimistic about the future of the American education system, and it's the love and support of her hometown that has made all of this possible, saying she is deeply grateful for having been entrusted with the sacred responsibility of educating San Diego children. The Senate will have to take up Martin's confirmation. In the meantime, the Board of Education has named District 2 Area Superintendent Lamont Jackson as her interim replacement. He'll serve through 2021. San Diego Unified did not make Martin available to discuss her nomination, but she's previously called on the incoming Biden administration to step up.
The federal response to the current education crisis should prioritize low-income students, special education students, and students from military families.
During her annual State of the District message in November, she asked the president-elect to implement changes within the first 100 days. She says the pandemic is disproportionately impacting communities of color, and schools play a role in addressing those disparities.
School counselors, social workers, and other specialized instructional support personnel must be able to address the emotional burdens and the trauma that many students will be carrying. This fact makes additional funding essential.
Martin shared the district's reopening plan that includes regularly testing teachers and staff with Biden's transition team. Part of it also focuses on teachers.
There is a lot of talk in Washington about technology. And while closing the digital divide is important, the way to help our students recover from a year in distance learning is not through more effective distance learning. Our students need their teachers.
Martin also said she wants to see a teacher corps established to help disadvantaged communities and create a plan that allows all 3- and 4-year-olds to access high-quality education. Matt Hoffman, KPBS News.
KPBS is making an effort to profile everyday San Diegans who have a story to tell, and that includes our caregivers. They're the link to our elderly in nursing homes, often doing backbreaking, emotionally exhausting work. One of those caregivers shared her experience with KPBS's Amita Sharma.
My name is Leah Farinas. I think being a caregiver is not a job, it's a calling. Because you should have the heart and the passion to do the job, because we're dealing with residents who has some memory issues and they tend to be like repetitive. But now that there's COVID, it's very challenging and it's very scary, because you might never know when you are gonna get the virus. I am married. I have one child. He's 4 years old, so that also adds to my stress and anxiety, and I also have my mother-in-law at home. Sometimes you just say to yourself that, what if I don't go to work, and be safer at home? But then you have to do your job. I just, take a deep breath before I go to work and pray and hope that, we are safe, the residents are safe. This pandemic has brought havoc, to everyone's life. It has brought so much loneliness, pain, and suffering to every resident. Sometimes when I go in to a resident's room, they will just cry, simply cry. And why are you crying? Are you sad? They will just say, I miss my family so much. I just give them hope that someday, all this the pandemic, everything will be over. I'm glad that a vaccine is coming. I hope it works. Too many people died from the virus. With this vaccine, I hope that it could eradicate, if not 100%, at least lessen the virus.
That was from KPBS reporter Amita Sharma. Medical workers of all stripes are being called on to help deliver vaccines, and it's a process that requires the utmost care. KPBS health reporter Taryn Mento recently got a look inside a training session.
Registered nurses like Celine Salazar already know how to give a shot.
We do flu vaccinations, and I know how it's prepped, like how it's handled beforehand.
But there are some other steps unique to the COVID-19 vaccines.
I thought they were very similar, like you just puncture it and bring it out and it would be ready. But the Pfizer needs to be reconstituted, apply normal saline into it and kind of bring it to life. And if it's not reconstituted with normal saline, once it's out of the fridge, it's only good for 2 hours.
While landscapers worked outside on a recent cloudless day, Salazar spent hours inside a county vaccine site learning the particulars for both the Pfizer and Moderna injections.
Moderna has to stay out for 15 minutes before it's used.
Salazar will take the handling, storing, and monitoring details back to volunteer healthcare workers with the nonprofit Champions for Health. They'll help the county vaccinate long-term care facilities not covered by retail pharmacies.
I'm ecstatic. I am like jittery with excitement to know that I, Celine, get to be part of this move.
Salazar's first patient during the training was just as excited to be on the other end of her syringe.
And I'm a nurse and I'll be administering the Moderna vaccine today. How are you feeling today?
Howard Fanning works at a behavioral health facility and has been wanting the vaccine since before it was even approved in the U.S.
I wanted to get it right away. I want to feel safe. I want everyone else to feel safe as well. I think it's my duty to do that, and for everybody else so we can move on with our lives.
As Salazar bared her arm for the vaccine, she says she's happy to be part of the effort to end the pandemic.
One day as I get older and I'm a grandma or, I'm not working, I could tell people like when COVID happened, I got to be a part of it. I got to not only sit down and look at it in the news, but be out there and be active and make a difference.
Taryn Mento, KPBS News.
It's a gesture of gratitude now that they have their vaccines. Some of America's healthcare workers have plans to be in Tampa in a couple of weeks.
So I know everyone in your area is a little excited about an event that's coming in a few weeks, the Super Bowl, I hope. The reason that I wanted to get on this call for a minute to thank you all is I wanted to tell you that we want your team to be there. So if you're able to swing it, I want to invite each member of your team, the 5 Waldermere unit, to be our guest at the Super Bowl. I don't know if that means you accept or not.
Yes, yes. We accept. Oh my gosh.
That's NFL Commissioner Roger Goodell making the surprise announcement. About 20,000 people will be allowed to attend Super Bowl 55 in Tampa. Most of the crowd will be healthcare workers invited from all 32 NFL cities. We end our special with a look at how the San Diego Symphony is making it through this challenging time. KPBS reporter John Carroll recently talked with the Symphony CEO about how to keep the music going when live performances just aren't possible.
The good old days, before anyone had ever heard the words coronavirus or COVID-19, a time when we could go and hear in person the world-class San Diego Symphony. Then, in March of last year, the live music stopped.
And so what do? You take a deep breath and you start to imagine what life looks like in the next iteration.
For the symphony, the next iteration looked like the next iteration of many arts organizations, moving online to the world of Zoom. That lasted for a couple of months. Then, as we all began to understand more about the virus, the look and sound was refined.
We were actually able to return to live performances, socially distanced, with strings wearing masks.
This is from a performance last November in the Conrad Prebys Performing Arts Center in La Jolla.
And this is the best quality live experience in a natural acoustic with beautiful camera work, bringing you really close to the players in the comfort of your own home. We do some beautiful pieces that often don't make their way to a concert program in our kind of traditional times, but beautiful serenades for strings alone or winds alone.
In 2002, the San Diego Symphony received a $100 million donation from Qualcomm founder Irwin Jacobs and his wife Joan, who, we should note, are also supporters of KPBS. Gilmer says the symphony only draws off the interest of that donation. The principal is left untouched. So keeping the symphony in good financial condition is a never-ending effort. The group's full-time musicians are on reduced hours and reduced pay, but their health benefits haven't been touched. Fortunately, Gilmer says season ticket holders and other donors to the organization have been generous, so the symphony is doing as well as can be expected. Now, the symphony is looking forward with great anticipation to performing again in front of live audiences. The first place we're likely to see that is the new Shell at Embarcadero Marina Park South, a magnificent addition to San Diego's waterfront.
Right now, when you go out there, you'll see that they're putting the inner liner in, covering up all of that technology. So it's not yet available, but it will be, I hope, very soon.
Very soon can't come soon enough for Gilmer.
There is the emotional impact of the pandemic on our musicians and on our staff and on our audience and our entire San Diego Symphony family. One of the things that is most difficult for me is that people really need, at this time more than ever, to be able to be together and to experience music which just, it carries you away. It takes you to another place. And of all times in our history, we need it more now than ever.
John Carroll, KPBS News.
And that's all for this special edition of KPBS News. I'm Maya Trabulsi, and for all of us here at KPBS, thank you for joining us and stay safe.